Today we will talk about intervertebral disc herniation and what is absolutely forbidden to do so you don't end up needing surgery. I'm Dr. Vasyl Chaika. Let's get started. So, when a person has back pain, and in particular an intervertebral hernia, there are 4 things that are strictly prohibited. First, strengthening the muscles with various exercises and going to the gym. In other words, physical exertion is a no-go. Second, getting any kind of massage. Third, spinal traction. And fourth, as people commonly say, putting the intervertebral discs back in place. But let's break down why exactly these things are forbidden, and let's not turn to something mythical, but to anatomy. So let's look at the anatomy. What you're about to learn now is practically impossible to find anywhere else. Not on the internet, not even in textbooks, not even medical ones. Why? Because people aren't supposed to know this. So let's figure this out, what you really need to know in order to understand what a hernia is and how to treat it. So first, how is the spine structured? We have vertebral bodies. Here they are shown in black. There is fluid located between them. This is called a disc. It consists of 2 parts. There's the fluid itself, also called the nucleus pulposus, and it's surrounded by a capsule, shown here in blue. It's the same here. Here's the fluid, and here's the blue capsule. This is the fibrous ring. What's important? What is the function of this nucleus pulposus, this disc? In fact, it's not meant to bear any load. Its job is to separate the 2 vertebrae from each other. In other words, it acts like a spacer, pushing these 2 vertebrae apart. Why? First, it's to stretch the ligaments so that these vertebrae don't move in different directions as they please. Second, it's to ensure the diameter of this corresponding opening. It's called the intervertebral foramen, where the nerve exits, and so that there is no compression there. And third, to provide the distance between these 2 halves, or in other words, to ensure movement in the intervertebral joint. We all know that movement in the body occurs only thanks to the joints. Only thanks to the joints. That's why the nucleus pulposus and the annulus fibrosus provide this function. What is important? The nucleus pulposus. Every day when you move into an upright position, it loses fluid because it cannot regenerate. Regeneration only occurs when you lie down in a horizontal position and sleep. That's when regeneration happens. And if your intervertebral disc, as it's called, decreases by just 1 millimeter, what will that lead to? The distance will sharply decrease. Right here, between these 2 halves of the intervertebral joint. Or where? Here they are, these halves. And this leads to an increase in the load on the intervertebral joints. How does the body work? It takes and increases the area of the joint. This leads to a decrease in the load on a unit of area. That's all there is to it. Yes, the body works very simply, but what does this lead to? And this then leads to what is called osteochondrosis. That is, the daily physical overload you experience causes the joint to enlarge, and this will lead to a reduction in the intervertebral foramen. So, what is the first thing you should do when you start having problems? And when it comes to what is called osteochondrosis and hernia, you shouldn't go to the gym and you shouldn't try to strengthen your muscles, because this will lead to even greater strain, which you already experience throughout the day. And in this way, you will provoke even more changes at the bone level, which will result in a narrowing of the intervertebral foramen, and of course compression of the neurovascular bundle and the nerve. And you will experience symptoms. That's why a person goes to the gym, works out intensively, but the pain continues. Because as they say, your muscles are weak. You can do a very simple experiment. Actually 2. The first one, when you take a piece of meat, buy it at the market, and put it directly on some surface, you can hit it with a hammer, you can fry it. The meat doesn't contract, nothing happens to it. But if you connect a nerve to it, then contraction occurs. So remember, the meat itself cannot contract. The meat itself cannot spasm. This only happens when the nerve is directly stimulated. So the second point, an important thing you shouldn't do is massage, because it doesn't work. But then, why does the muscle spasm? Why do these muscles spasm in us? The masseur tells you that your muscles are blocked. A muscle spasms as a compensatory reaction when there is trauma to the nerve. Here, in this foraminal opening, the body reflexively spasms the muscle to limit movement right here. Because if these little joints start to move, they will cause injury. What? Directly to the nerve itself, and that will cause you discomfort. That's why the wise body came up with a protective mechanism. It spasms the muscles to limit that movement. By relaxing the muscles, massaging the problem areas, you again restore the load on the intervertebral joints. Your symptoms seem to disappear, but the load increases, and once again the pressure on the nucleus pulposus rises. This leads to an even greater increase in the hernia. That's why we do massages, but nothing works out for us. The hernia remains. Next, what else is an important point? It's traction, which is highly recommended to perform. So why is it not recommended to do traction? So when pain occurs in such cases, of course, swelling also appears. Swelling appears in this area. Look, here's a very simple experiment. Here's a sheet of paper for you. This represents the ligament apparatus. When you start stretching it, do you see how strong it is? I can't tear it. Now look, what happens when inflammation occurs? Basically swelling. Now we simply wet the sheet of paper with plain water. It's a bit damp now, see? And now let me try again. To do what? To stretch it. Look, see how easily it tears now? That's why this leads to ligament rupture and further hernia enlargement. So if you want to do traction, you need to make sure that the inflammation and swelling are completely gone. Only then can you proceed with traction. What else is important? This is what is called repositioning the intervertebral disc. You can't actually reposition it. It's water. So what you feel, the click that happens, is actually a release. It's this interspinous joint. You can check this yourself. It happens with any joint. Here's the sound. You hear it, it's the fingers clicking. That's what's happening. So it's not the disc being put back in place, but rather the joint unlocking. But if a doctor or another specialist is working with you, as long as there's no crunching, no herniation, remember that the crunching sound, it's also a sign of a fracture. A fracture has 4 absolute signs, and one of them is a crunching sound. So be careful. But now what should you do? What should you do when you're in pain? After all, it's the hernia that causes the pain. And that's another mistake. Let's break down why. When we already know the anatomy, for example, the same intervertebral disc, here we have a hernia drawn. What is important? A hernia cannot protrude into the spinal canal because, as shown here in red, there is what is called the posterior longitudinal ligament. It never ruptures. The only way it can rupture is if there is a spinal fracture. That's why it can't protrude and the disc can't wear away. But what is important to remember? Here is the nerve. A nerve is simply a small structure only about 1 centimeter long that passes through the intervertebral foramen. It's right here. This is the capsule of the intervertebral joint. Here you can see the spinal cord and the vertebral canal. And for example, if you have pain in your cervical spine, they tell you it's a hernia, your neck hurts, it's a hernia. Why are they deceiving you? Now look, if it were a hernia, here it would be pressing backward. The first thing it would press on would be the spinal cord and the motor root. Here it is shown in blue. In that case, your first symptom would not be pain. If we affect the motor root, you would develop paresis. That is, you wake up in the morning and your arm doesn't move. Then the hernia continues to grow. It keeps pressing and presses here on this green root. The green root is the autonomic one, so your arm would wither. And here at the very end, right here, almost next to the spine, is the sensory root. So if the hernia caused you pain, first your arm would stop working, then it would wither, and only then would the pain appear. That's all. But what actually causes pain, for example, in the cervical spine? Isolated pain is caused by irritation of this sensory root. What irritates it? As we discussed, the overgrowth of this bony mass, swelling of the capsule of the facet joint. So once again, why shouldn't you put stress on it? Because as soon as you start building up the muscles, you increase the load on the joint. What does this lead to? It leads to the growth of bone mass and more trauma. Why shouldn't you get a massage? Because you remove the protective mechanism and the load increases even more. Why shouldn't you do traction? Because it will cause a tear, remember? And why else shouldn't you do it? Intensive adjustments, remember, at first can cause trauma. But what should you do? What should you do and how can you relieve the pain so that the hernia heals? Or maybe this, yes. And for this, the main task is first of all to reduce the swelling. And we can reduce this swelling with a simple procedure. It's called a bath. Not swimming, because when you swim, there is still movement in the spine, and this puts even more strain on it. Just an ordinary bath. You take a bath, filling it halfway with water. The temperature of this water should be 35, 36, 37, at most up to 38 degrees. If the water temperature is above 38 degrees up to 40, it will increase the swelling. And the more swelling there is, the more the nerve root will be compressed. The pain will be greater. To this water, for every 100 liters, you add another 900 grams of regular table salt, lie down and just stay like that. After lying for an hour and a half to 2 hours, carefully get out of the bath and then go rest. And when you have pain, when you have a hernia, this will reduce the swelling and improve your condition. What else do we need to actually restore the height of the intervertebral disc? Of course, it's walking. Just walk at a comfortable pace for about an hour. That's why walking is the first exercise if you want to detect or treat an intervertebral disc hernia. But there's something else that helps too. Look, please, at this image. In this image, you can see how in 6 months there was a giant hernia that almost completely blocked the entire intervertebral spinal canal, and then after several months it's gone. And maybe the person was doing exercises. No, they were taking baths daily and they were walking. So please remember, only knowledge of anatomy will give you the opportunity to be healthy. A lack of knowledge will lead to a lifetime of treatment and eventually to the operating table. This was Dr. Vasyl Chaika with you. See you next time.